Okay, we'll go ahead and get started. Hello, everyone. Again, good afternoon or morning, depending on where you are joining us from. Thank you for joining our Environmental Health Institute today. We are so excited to have you all join us. My name is Maddie Curry, and I am a member of the Blackfeet Nation and also a public health policy and programs coordinator who works on our environmental health projects here at the National Indian Health Board. So just a few housekeeping items before we get started for our institute today. This presentation is currently being recorded. So if you are hop off and watch this institute at a later time, again, this recording will be posted on our NIHB website after the conclusion of this conference. Your microphone is hopefully currently muted. So can you please keep it this way? And if you have any questions, please feel free to write them in the chat box as we go along. And I will be monitoring the chat box, and we'll make sure that our presenters answer your questions at the end of their presentation. Finally, please take a few seconds after today's workshop to fill out our evaluation. You can find it in a link that says, please fill out the session evaluation on the same page in the online conference agenda under the session description. So going over today's agenda, we are first going to hear from Angie Hacker at, can you mute people, at Proper Sustainability. For the 4 years, NIHB has been working on a project called Climate Ready Tribes, where tribes are funded to support their climate change work in their unique environments. The Paula Band of Mission Indians in the San Diego and Southern California area has been focusing on climate change adaptation in light of the COVID-19 pandemic. Our Paula's Environmental Health Director, Shasta, is here with us today, and she will be supporting Angie with Shasta over the course of the project, and they're going to be talking about their work. And then from 1 to 2, we will have the National Tribal Air Association joining us to talk about the work that they have achieved this year, and then also their annual Status of Tribal Air report. Lastly, Craig Creeman, the Environmental Director of the Quapaw Nation, is here today to discuss environmental health topics in his tribe. Again, thank you all for being here today, and I will stop my share. Angie, I will let you lead.
All right. Good morning, everybody. I'm here in Chumash Lands in Carpinteria, California, and just wanted to start off by saying thank you to the NIHB for inviting us to speak at this important summit. And I get to talk to you about how climate change affects tribal health and what we have learned about what tribes can do about those effects. And I am joined by Shasta. We're going to introduce ourselves in just a minute, but I like to kick off with just a little bit more about the topic. So I think in this audience, we all know, tribes have always known, that there are countless ways that the health of the environment affects our health and well-being. And as we're seeing our global climate change, we are all experiencing just how much life on Earth depends on, is shaped by, and affects climate. And I'm sure many of you are paying attention to what has become a growing topic, health and climate change, in anything from mainstream media to medical journals, and sort of the consensus is that climate change is the biggest public health threat of the 21st century. A journal article recently also stated that a stable climate is the most fundamental determinant of human health. The most is having a stable climate. So when we're talking about health, especially in a tribal context, we're not just talking about Western medicine. We're talking about tribes who like to look at holistically at well-being. And so we've learned a lot from the tribes that we have gotten to work with over the past at least 6 years of the Tribal Climate Health Project, which we'll tell you about today. They have a long legacy of respect and stewardship of the environment, considering the impacts on future generations, and the tribes we work with will often relay that the balance and harmony of people and the environment appears to be slipping away. So with that, I think I will tell you a little bit more just about who I am. So I'm Angie Hacker. I am with Prosper Sustainably, and I've been serving communities in the area of climate change, energy, and sustainability for over 20 years, both inside and outside government. And now I'm a consultant at a firm that I co-own called Prosper Sustainably. And as a consultant, I work primarily with local and tribal communities. One of my favorite roles is as lead consultant on the federally funded Tribal Climate Health Project, which is led by Shasta Gone, and she's going to introduce herself in just a minute, and the Palabana Mission Indians in San Diego. So for the last almost 6 years, we've been compiling and developing resources and expertise to make it easier for over 1,000 tribal serving professionals to protect the health and well-being of their community in the face of climate change. Speaking of health, Shasta's a little under the weather. She'll be resting today, but she has shown up anyways because she is so committed, and I want to give her a chance to introduce herself and help me out a little with this presentation as much as she's comfortable. So go ahead, Shasta.
Yeah, thanks, Angie. It's true. I'm coming to you today from my house rather than my office. I am right on the borderlands between Kumeyaay and Payumkawitchum territory in San Diego County. Yeah, recovering from bilateral pulmonary embolisms or blood clots in my lungs. So yeah, but I'm here, and I'll be jumping in here and there where I can. But most of this heavy lifting today is going to be done by Angie. But I am the environmental director. I'm also the tribal historic preservation officer for the Paula Band, and just about 25 miles north of where I'm sitting right now. And it's just been a great part of my work over these last 6 years to be focused on the Tribal Climate Health Project, and excited to be able to share it with all of you today.
Shasta, did you want to do this slide, or would you like me to take over?
I think you should probably go ahead.
Okay. So just to tell you a little bit more, so the Palabana Mission Indians, they are located in northern San Diego in California, and it has really become a national leader on climate change and health adaptation, really in large part thanks to Shasta, who continuously takes on as much as she possibly can and more to help build capacity around the country for tribes that are trying to address the health impacts and other impacts of climate change. So, 6 years ago, we got some federal funds. We continue to get federal, state, and NGO funding, actually from NIHB and others. And so that has gone directly to Shasta's department, the Paula Environmental Department, who has hired on Prosper Sustainably to help them administer a couple of programs. And so they work together. And I'm mentioning it now because this is going to kind of recur. We've been so fortunate to receive NIHB dollars for the Climate Ready Tribes program, and that has mostly been helpful in getting the Palabana Mission Indians to have the resources they need to do their own adaptation work. So that has meant completing an adaptation plan, and then learning by going through, learn by doing, going through the process themselves of what it takes to actually identify and then address the health impacts that are coming to their community. And there's an element of intertribal sharing as part of that work. And it's a sort of a collaborative approach to climate adaptation. And then there's a sharing over on the Tribal Climate Health side of things. So Paula, as also the leader of the Tribal Climate Health Project, has a platform to help distribute and share that information in all sorts of different ways to build capacity for tribes around the country to address the health and other impacts of climate change. And a little bit more about our work. So I just want to share kind of what we've been able to do with the resources that we've received from the NIHB and the Climate Ready Tribes program. So that project has gone on for several years now, and it was to build Paula's community resilience to health and psychosocial impacts of climate change through the implementation and tracking of community-driven adaptation plans and strategies, stronger partnerships, and sustained capacity. And we're just really fortunate to have received funds to do that work. You might be saying, what is psychosocial? And we're going to get into sort of all of that. But think of it for now as sort of a collective mental health on a community scale. And so what we have been able to accomplish in the 4 years that we have received resources from the Climate Ready Tribes program has been really to develop and do some early implementation of Paula's adaptation plan. And so that has involved continued stakeholder engagement, including tribal collaboration with the other tribes within the Southern California region, and interdepartmental implementation tracking. So it's helping us not just have a plan, but a plan that maybe without resources, plans oftentimes can sit and collect dust. This plan, because there's ongoing support for it, has a life to be dynamic and continuously implemented and tracked. And so that's been really important and helped us, I think, keep sharpening our teeth as we are trying to do the work of helping all the tribes around the country to do as much as they can to address their impacts. And so along with that has been community education, and you see some things on the right there, a couple of fact sheets. Those are just examples of what we learned out of the Paula adaptation process, the planning process, about what were their vulnerabilities. And we looked specifically for Paula at temperature extremes, wildfire, storms and flooding, and drought. Those are 4 out of the 5 main exposure areas that we always look for. And then secondary exposures, which really do contribute quite significantly to health, including worsened air quality, vector changes, water insecurity, and food insecurity. And so part of that was identifying what those impacts would be, the severity and likelihood, whether or not, which of those are really the most significant that should be addressed with strategies and investments, and then coming up with ways to educate the community about those hazards and risks, and even the symptoms, what to look for, how to recognize when these things are happening, so that we can get ahead of it a little bit with a little bit more community awareness. And so that has meant not just education, but also specifically we've done psychosocial resilience training. So we really did want to focus in on this topic of psychosocial resilience. A lot of the work that we continuously do has been sort of a research focus. And so learning about how do you actually, how can you prepare a community to cope better mentally and psychosocially with the impacts of climate change. We just took a real interest in that because we felt like that was going to be an area where a lot of the suffering was going to occur, even though it's less visible than something like an asthma attack, or something like an injury, or a heat-related illness, but incredibly pervasive, especially when we're starting to see these more frequent and more intense traumatic climate events. So we've brought in lots of experts on various subjects, including the psychosocial resilience aspect, to help us with the publication and actually conduct trainings on site at Paula with staff, with community members, and with neighboring tribes to try to see if we could find tangible ways to really prepare the community from a psychosocial perspective. So really interesting, folding in the concepts around cultural well-being into that process as well. And then another big aspect of the Climate Ready Tribes project has been translating what we know about climate change into emergency preparedness. And there's obviously a strong relationship between the two. And so Shasta was very clear that she wanted a better process to notify her community in real time about climate events as they occur. And that could be anything from a major storm to a heat wave to something like air quality concerns. Shasta, what else? I think some unique circumstances.
Yeah, so we've developed an opt-in text alert system for our communities, so that when something's happening, and honestly, whether it's climate related or not, and oh, here comes my cat's tail. That was Charles. So we've been able to let people know when there's going to be, like Angie mentioned, a high heat event, and let them know where the cooling centers are, or if we're going to be at risk of having our power shut off. In California, because of wildfires, we have what are called public safety power shutoffs, where the local utilities.
Yeah, let me know if you need anything, okay?
Thanks, Zachary, we will. You know what, you gotta joke with the people who forget to mute themselves. But we have these public safety power shutoffs where they're trying to keep the power lines in high heat, high wind vents from potentially sparking wildfires. But when the power is shut off, that means that people's air conditioning doesn't work. So we use our text alert system to let people know this is coming up. Maybe you need to set up your generator, and then how to safely set up a generator. I mean, it's just a cascade of different potential effects. And even a few weeks ago, I used it to let people know that the main highway out of the reservation had been blocked by a serious car accident, and to use alternative routes out of the reservation. So it's been not just climate, it's been overall disaster preparedness, and it's been terrific.
Right. And, so that actually, there's a fine line between climate change and disaster preparedness. And then along came COVID, and a couple of years into having this kind of funding. And so trying to build in, pandemic, addressing a pandemic and trying to get ahead of some of the things that we could with some of the similar kinds of work. And so that has meant things like in the emergency planning process. So Shasta has actually used some of the dollars to support an emergency planning effort and building out some of the hazard appendices of her emergency plan, including pandemic, wildfire, and I think now next extreme heat, or maybe I mix those two up. And then we actually dove last year pretty deeply into a publication and research, which was an attempt to translate COVID lessons that were being learned in Indian country into climate preparation, and to try to understand the parallels there. What were we learning out of the acute experience of COVID that, if fortified or strengthened or just looked at it differently, could actually help us as we're trying to prepare better for climate change? And there were some really key areas that we found that were translatable, and we have a publication on that, thanks to these dollars. So, and now this year doing a little bit more of an internal look at that same concept of looking, we're going to look at, Shasta would like to look internally at her community and collecting Paula's experiences on climate change and pandemic health concerns to really see in what ways they can translate what we know into better preparedness overall. So, all of this has really, because there was this money, has set the stage for this kind of proliferation of Shasta and her team being able to do more to adapt. And so other grant funded projects have increased the climate readiness at Paula to do resilience work, like a transportation adaptation plan and a flood mitigation plan, and all these things that we had outlined that there were sort of weaknesses or gaps in doing. Like, we needed to, sometimes a strategy for adaptation might look more like another plan, but that's because there's really more information we need to know. And so this continued checking off of what we can do in a phased approach is really how we've walked the talk at Paula, and now trying to translate that over into the platform. We have this microphone through the Tribal Climate Health Project to talk to the whole country, tribes around the country, about what we've learned and how they might too address their key concerns, and using a values-based approach. And so the Tribal Climate Health Project's objective is to build knowledge and capacity for tribal serving professionals working to prepare U.S. tribes for the health and other impacts of climate change. We've done presentations all over the country, in person, and lots of times, especially in the last couple of years, remote. And so over 25 trainings, 7 full trainings. And in fact, we have another one coming up in person in July at Paula, a training, a summit, and a lot of other content for sort of a national audience on a variety of topics. Like I said, we dove deep on psychosocial resilience. We dove deep on data, and we're going to talk about that a little bit more today, on how do you get the information you need to make good decisions to help you really invest in where the biggest and most significant vulnerabilities are for your particular community, taking into account what that community really wants to protect. And then taking that data down the road, we've sort of got additional dollars thanks to the BIA for several rounds of what we call an intertribal resilience data development project in California, where we're taking a data tool that we have developed to help make it easier, sort of lift the burden off tribes of having to do an intense fact-finding process and try to make it a little simpler to get through the process to understand what their key vulnerabilities are. They can move on to action. So we've been refining that tool with a lot of expertise around us, and we ended up forming what we're calling a National Tribal Resilience Data Work Group. And the whole goal is to sort of collectively get the experts around us to think into solutions for making data more accessible to tribes to make good decisions about health and climate adaptation. Okay, so we're going to just continue telling you a little bit about what we know and kind of some resources that we have to share. In doing all the research that it took to develop the Tribal Climate Health Project, our curriculum, and our content that we're able to share, we needed to start off with a framework. And so this framework illustrates the cascading effects of climate change and how communities can protect themselves and their assets against harmful impacts. And so I already told you about some of those primary exposures, those top primary exposures: temperature extremes, wildfire, storms and flooding, drought, also melting ice and sea level rise, which wasn't an area that Paula had to dive into too deeply. Those secondary exposures down below are a cascading effect of those exposures, meaning wildfire obviously creates an increase in smoke and particulate matter. Storms and flooding changes the breeding and distribution of vectors that carry disease. Things like drought obviously is going to affect water security, but all of these exposures kind of intersect with each other and intersect with various secondary exposures, including food insecurity, to create impacts. And impacts are when the climate conditions are hitting a community, coming into contact with its natural environment, built environment, and health and social environment. So I guess we could have taken a blind eye to the other kinds of impacts outside of health, but when it comes to tribes, and really when it comes to reality, the health and social environment is what we believe we should center adaptation work on. And so we are very aware of the interplay between the natural environment, the built environment, and the health and social environment, that to keep nature and human health intact, we need to think about our built environment. We need to keep our natural environment healthy and our natural resources healthy. So this interplay, and then at the end of the day, coming up with strategies, once we know what impacts are coming, strategies that can really help protect the things that the community cares most about on the ground. And so assets for us has meant anything from sovereignty to education to a road to a critical economic driver. And so another sort of step down is just looking a little more deeply at what we know about climate change and health. So looking at, we've looked at all the best practices and literature out there and trying to boil down in this framework a little bit more detail about, how those primary and secondary exposures lead to health impacts. And we really look at them as kind of 4 chunks. We've got physical health, mental health, socioeconomic health, and cultural and spiritual health. And just to give you a little bit of a deeper dive into what some of those are, because we're not going to have a chance to go through all of the exposures and how they affect health, although we do that in our trainings. But some of the examples of illness that, some are more obvious than others, obviously heat-related illness and mortality, but also a worsening of chronic illness, especially as temperatures increase. Asthma and respiratory illness, sometimes as a result of the heat, exposure to heat and increasing levels of ground level ozone, obviously with wildfire and particulate matter, also with allergens, the changing of seasons and distribution of pollen. vector-borne illness, infections due to contact with ingestion of pathogens, ingestion, inhalation, that should be. And also something that you might not be thinking about, but folks that are dependent upon electricity-dependent devices for their health, things like dialysis perhaps, would be affected in the case where a climate event disrupts power. So those are just some examples of physical health. And then I wanted to, Shasta, I don't know if you're still available to chime in here, but some examples of what we consider cultural or spiritual health.
Yeah, I can cover that a little bit. So I'm also Paula's Tribal Historic Preservation Officer. I want to make clear I'm not Indigenous myself, but I've worked in Paula for over 17 years now. And when we talk about climate change, not only in Paula, but with other tribes, a lot of what we hear is about a lack of access or changes to important traditional practices or plants, medicines, hunting, fishing. All of these things are being affected by climate change. And I've had my friends in Northern California, at the Yurok and Hoopa and Karuk tribes, talk about an inability to access, for example, fishing, that the salmon are being affected by climate change. And that's not just about food. That's about, for the Yurok, that's about who they are as a people. And if climate change is affecting your ability to fish, and then it affects your cultural, spiritual well-being as well. For the Karuk folks, they've had a lot of impacts from fire that has affected sacred sites, and that is an effect on who you are as a people. And we all know that in Indian country in general, there's already a lot of a lack of access to resources for health. And it's just exacerbated by these climate effects, especially when the medical folks don't necessarily understand the connection between the environment and the people. And so that's something we've really been trying to focus on. And when we can, take our opportunity to address medical professionals who aren't tribal specialists and let them know that, for example, snow not coming until late in the season might mean that a ceremony can't be done that relies on a first snowfall, and just all the things that you need to know about the local tribes in your community. That all is tied in with climate. So the people and the environment, that's the reason I'm the environmental director and the TIPO, because you cannot separate the people from the land. And that's an important lesson that we're trying to focus on, not only for tribal communities, but again, for those who work in tribal communities.
And just to touch a little bit also on this mental health piece, what does that look like? We've talked a little about the psychosocial piece, but what we see in the literature and the research is, and in the experiences when we talk to folks on the ground, is a potential for increased conflict and aggression. So we see, especially in high heat areas, just a higher propensity, or just in high stress moments, including sort of during and after a climate disaster. Trauma, stress, anxiety, grief, and helplessness, and those are just among some of the potential mental health impacts of climate change. Not to mention what I think the literature is starting to say about even neurological mental health effects that come from a neurological or physiological problem like infectious disease. Okay. The point of this slide is really just to say, tribes are experiencing climate change differently in different places. And so all of you from around the country are probably experiencing it very differently. So Shasta, of course, has seen heat, drought, wildfire, and occasional flooding as being her big exposures, and those are sort of expressing themselves in impacts in all sorts of ways that are all written up in our vulnerability assessment. But in the Pacific Northwest and Great Lakes areas, we tend to see tribes talking about fishing, food, and forests. In Alaska, coastal tribes are experiencing permafrost thaw, erosion, effects to their hunting practices, like Shasta was just talking about, the traditional hunting. Navajo, we hear a lot about heat and water insecurity. At the Mojave, there's a shrinking river that's affecting a spiritual practice. In Florida, we see things like hurricanes and sea level rise. It may affect cultural resources on their coast. Lakota has experienced extreme flooding, including something called a bomb cyclone. So just these extreme weather events, very different all over the country. And these probably seem quite familiar to some of you living in the regions we're talking about. I was potentially going to share a video here, but I think I will move along. We are just about to debut a whole short video series where we have described each of these exposures and their health impacts in sort of these snack size videos. So we'll share that, and hopefully NHB can help us get that out with everybody. But when you look at the potential for impacts of climate change, even just in health, but knowing that there are far greater, there's many more impacts outside of that, you start getting a bit overwhelmed. The volume of potential impacts can be overwhelming. This is it's Western data, but it's some data, some ways to look at various kinds of health impacts. And so on the left there, you're seeing, this is from the CDC's National Environmental Public Health Tracking Network, which is one of my favorite data sets. And it's air quality map, and it's showing areas and populations vulnerable to predicted surface smoke from wildfires. So obviously in California, that's been a good one for us to know where are the areas that are potentially greatly affected. And the nice thing about that one, and sort of is unique, is it's going down below us. It's a sub-county level data set. So you're looking at, I think it's census tracts here. On the right of that, it's another one. This is on flood vulnerability. It's the same data. It's the same CDC data set. And it's on flood vulnerability. It's the number of people within a FEMA designated flood hazard area. And so you can see the dark blue there. If you're looking from around the country, you're kind of saying where you might be in a flood hazard area. You might have better data in-house, and that's what we always say, use it. But there's a lot of data out there in these nice visualized tools that can make it a lot easier to see what's coming and what's happening, including projections like and trends. So down below, you can see changes in Lyme disease case report distribution. So you can see in different climate scenarios, which might just mean, is it a lower emission? Are we predicting that emissions will be higher, but not as high as a high scenario, or we're predicting that it's going to be sort of the worst case scenario, the high scenario? So just it's a prediction of the level of emissions we will produce on Earth over the course of time, and sort of in this one is, I think, by the end of the century. So we're looking at the changes, and you can see the distribution changed dramatically in Lyme disease from 2001 to 2014, and then further since, and changes in the mortality rate related to Lyme disease. And then on the right here, this is projected percent change in national crop yields. And you can imagine, obviously, crops are an important aspect of food security and health, and just changes to crops, based on the different emission scenarios in the future. So projections looking out forward into the future. And that's some of the beauty of what's happening in the climate data world today, is more and more modeled projections about what we might be experiencing in the future, so we can know about it now, kind of become aware of these blind spots, and see if we can do something about it, even if it's just to protect our communities. And so the thing we like to say here is that of all of these kinds of impacts, what the literature always says is, and what we hear from tribes too, is that tribes are disproportionately vulnerable. And it is true, and oftentimes that might be a result of tribes, historical oppression in many forms, including lack of resources, divestment, and the taking of land, and pushing tribes from their ancestral lands to lands that perhaps have higher vulnerabilities to begin with, less resources. And so we know all of this is not, climate change is not an issue in solidarity. It has to be looked at in the context of tribal experiences over the last several hundred years. And attribution has to be selective about what is really man-made decisions that are not climate change versus what is really happening with climate change. But what we like to, we like to hear from tribes all the time is that we're not just vulnerable, we're uniquely resilient, and we know how to survive because we've done it for thousands of years and we'll continue to do it. And we know a lot and we have a lot to share. And so obviously with traditional ecological knowledges and just all sorts of strategies that non-tribal communities, I always think, can learn a lot from. And so that's kind of the good news, is that through adaptation, negative health effects can be prevented. And I think that, the word adaptation is maybe not something that's most tribes are even using. It's just something that they are doing and that they've always done. But what it really means is that you are attempting to address and lower the risk of an impact that may be coming your way by doing something proactive about it. So there's all sorts of strategies. And so here's a framework that we like to share, which is really just a culmination of the best practices out there, which really just says the first thing that you do when you want to go and try to decide what the best actions would be to take for your community would be to conduct a vulnerability assessment. And that's really an assessment of the information you can access to identify what are your greatest vulnerabilities. So that might be looking at your, what are those exposures coming your way? What do we know about the trends and the impacts that are happening? How sensitive is your community? In what ways have they already adapted? Do they have, these strengths already that they can build upon? And then once you've identified those vulnerabilities, then you move into an adaptation plan. An adaptation plan is really the process of taking action to reduce or manage risks associated with climate change. And the plan is to identify what actions to take and to think about how you might roll those out. And then you go into this cycle of, you adopt it, you implement it, you're evaluating it over time, and then you occasionally update it based on new information. And there really isn't a one right way to do it. But we like to look across lots of models and try to take the best pieces out of all of them. And the other way to do it, if you don't want to do a climate change adaptation planning process, is to build climate change and the knowledge of climate change, including the projections into other planning processes. And that might look like, we were talking about emergency planning. It could look like building climate projections into your hazard mitigation plan, or maybe your community does something like a community health needs assessment. What institutionalized processes already exist that should also include climate change information so that you can be the most prepared as possible. And like we say, prevent as many negative health effects as we can. So I think we'll talk a little bit, I'm just going into some of the process that we usually talk about in our trainings and what has really set the foundation for some of the tools that we've built. I'm going to share some of those with you. This is just like a teaser of some of the things that the Tribal Climate Health Project can offer. And so, like we said, that data is a big piece. And when we're talking about a vulnerability assessment, on the left there is a series of 5 steps. In our trainings, we go through each of these in quite a bit of detail and do a lot of discussion around it and look at some case studies and try to understand what different practices tribes are using. First step is to determine the objectives and scope, such as what's your study area? I have an interesting project right now. We're just trying to determine to what extent we're going to look at an entire ancestral lands versus just a reservation. So that's been interesting. Are you going to look at all the impacts? Are you just really interested in your natural environment? Are you going to look at all the exposures? Do you want to do a specific one related to heat? Or are you going to look at all of your asset types? Are you really just looking at your critical economic facilities? There are all sorts of different ways to do it. The second step would to be, engage your community. And a really big part of that is to understand your tribe's perspectives, its values, what it wants to protect, what experiences it's having, and what knowledge it's holding. And so you may, maybe there's some recorded knowledge already, traditional ecological knowledges, or you may have to do interviewing of elders, or you do a survey, or you do workshops. And there's all different ways to engage your community and really understand its perspectives. And I feel like this is a critical piece of it to really understand, to make sure that you're tying climate change meaningfully to the context and the culture that you live in or work in. So then these pieces 2, 3, and 4 are all about looking for information and trying to make meaning of it. So identifying key indicators just means, all right, well, what are we looking for? what is it? What kinds of potential impacts should we look for information about and try to learn about their severity and likelihood? And then we're going to go and gather information about those and analyze it. And so we really took the information and fact-finding process very seriously, because what we realized is that we may have access to training a lot of people in a lot of different contexts. Sometimes we have an hour with them. Sometimes we have 3 days in person. Sometimes we have one training a month for a whole year. So we have all these different scenarios. It's never enough to really help folks do this fact-finding process, which is very overwhelming. And so it's this data process, this gathering of even community information can be so daunting that we really wanted to dive into it and create more of a systems approach to see if we could ease the burden off tribes a bit. And so I'll talk a bit about that, but really it's part of what's usually recommended as a braided approach. So it tries to braid in internal information with external information. And so internal being anything that you can get from within the tribe, with external information, which would be credible reports and studies, publicly accessible databases. And use both. Use whatever you can to try to illuminate in as many blind spots as you can. And then just make the best decisions. You have a limited amount of money, amount of resources and time to invest in strategies. Let's make sure they're invested in the best ones we can. And so what are we looking for when we're looking for information? Well, vulnerability, we say, is a function of the exposure risk, which is those primary and secondary exposures we talked about, the impact risk, meaning that might be the impact itself. What do heat-related illness trends look like? How many people have been temporarily relocated? How many power outages are we experiencing? How many times have we had to evacuate people for flooding? And so looking at what's actually occurring and then what's projected to occur, and tying that to what impacts are happening to the things that the community cares about, those valued assets. And so the understanding of those two things, what are the impacts and what is it affecting that the community cares about, are things that we really pride ourselves on looking at deeply and taking sort of centering our adaptation planning process on. And then you moderate the risk of those vulnerabilities up or down by saying, well, our population is extremely sensitive in some areas. Maybe we have really high volume of elders or high volume of people with chronic illness, or a really high urban heat island effect, or a really low tree canopy, or not a lot of people with health insurance. So these things that might make community characteristics that make your community especially more or less vulnerable to these impacts that we know are coming. And then you can moderate down the risk if you have some ability already to adapt. So adaptive capacity might mean, well, we already have established a cooling center, so our ability to adapt to heat is a little bit better. Or we've undergrounded our wires, our electricity wires, so we're a little bit more protected from wildfire power outages, things like that, things that you've already taken place to protect the community. And so those are all kinds of information that go into making sort of the best decisions we can with known information about our vulnerabilities. And so here's one thing I wanted to share with you, which is just some of our resources. So if you're on the computer right now, you can go to tribalclimatehealth.org. I think Shasta posted a link to it also in the chat. You can go to, if you go to Learn, you can go to something called Training Materials, and this page will pop up if you scroll down. You can get access to all of our materials, including this adaptation planning tool. It's called the Exposures, Impacts, and Strategies Inventory Tool. So it's something that, like I said, we've continuously built upon, and we have a new version coming out soon, but it's funded by the BIA's support over the last several years. And it's this customizable companion tool. It's there to help you gather this data. And I'm going to show it to you. I'm going to show you like a slide of it. But it's really attempting to say, you don't have to start from scratch. If you haven't thought about what climate change could possibly mean, you don't have to do all the research and go, trying to hunt down the best data sources all by yourself. We've done some of that for you. We also have a survey template. We have sample reports. We have fact sheets. We have a variety of different tools for you. And what we tried to do is make things as easy as possible. If we could lift the burden off of tribes trying to do this work, we will. And of course, the most important thing we will never be able to lift off of tribes is their ability to connect with their community, understand those values, engage, and do the actual work of action. We're just trying to help them get to the point where these other things are more manageable. And so I'm going to touch a little bit upon how these tools can help you gather, like I said, internal vulnerability information and external vulnerability information. So one way to gather internal vulnerability information is through this survey, and it's just a Google form, and you can access it for free. Just we'll make a copy for you and just give you access. And so the purpose of it is to try to get experiences and priorities, more information about experiences and priorities from your community. Oftentimes you can actually even get good stories or quotes from your community that really help contextualize the experiences that they're having or the concerns that they have. Those go really nicely into a vulnerability assessment report, as long as you share with them that you're going to use it. And then you get really good information like which climate exposures are they most concerned about. This community was most concerned about wildfire. And then we keep talking about those community assets. Well, here's some of them, and all of them are actually popping up here, but you won't know. I don't know when I go in and help a community, because I do create adaptation plans for tribal communities as well. Unless I ask them what community assets are their most critical, most high priority, I will not know. I will guess, and I will inevitably always get it wrong. This community, for example, counted water resources at the bottom as its #1 priority, and I just wouldn't know if I didn't ask. So I like to ask. Some other ways to get internal vulnerability information is GIS. Now, not everybody has a GIS expert. They don't have that kind of expertise in-house, so maybe they can access it, but only through consulting. But we didn't actually use GIS much for Paula's first adaptation plan, but we have used it for the tribal transportation climate adaptation work that we have just done for Paula and one of their neighboring tribes. And so we had a consultant involved who was able to run all these GIS analyses, and we were able to overlay things like fire risk on top of Paula's map of its surface area, and pinpointing things like where critical infrastructure was, transportation infrastructure, where critical other infrastructure is, or critical other facilities, like where's the hospital? How do people need to get from this neighborhood over here that's in a fire risk area to the hospital if there's some sort of a fire or evacuation or road closure? And then flood risk over there on the right, and that's really along the river. What assets are expected, what assets, neighborhoods, and natural resources are expected to be affected by floods. And it helps to see it visually if you can. Now, there's all sorts of things that you can get externally, and we really recommend that you do because it's becoming so much easier to analyze and manage. So we have something called a resource clearinghouse. We're just sharing it with you. It's easy to find from tribalclimatehealth.org's homepage. And there's about 500 resources here that have, if you can find them by searching when there's all these filters, or by the search box. You can query this for anything related to tribes, climate change, and health. And there's a lot if you're just looking to sort of learn or look at case studies, or even review past educational events. And then so I talked about the easy tool, and I'll just show it to you quickly. And it's a companion to our trainings. It follows the framework that we talked about: the primary exposure, secondary exposure, impacts, and strategies. And it provides all of this kind of access to data. And that's its whole job, is to just make that process easier for you. And it's also a filterable and customizable worksheet. So you can actually use it not just to identify where to go get this publicly accessible data, but also to use it as a worksheet to drop in the information as you find it on historical, baseline, and projected information. And so it's an Excel. It's not super fancy, but it just has a lot of relational information. I mean, it's an inventory. Here's all the possible exposures, any secondary exposures that the research says is related to it, what regions are at the greatest risk of these exposures, and then what are the indicators, meaning how would you possibly measure whether the severity and likelihood of any key exposure. And if you were to measure it, where would you go for the actual data? So these are basically, it's a menu, a long menu, both of exposures and impacts of indicators. And you can decide which indicators are meaningful for you. Maybe there's more than this and you want to add to it. It's all customizable. And here's some suggested data sources that we know of that where you can actually go and find some information that probably doesn't go down to your tribal boundary, but we'll get as close as we can. So it's national data sources. And then because we do a lot of work in California and there are some really good specific California data sets, so we have some columns there. And oops, and what this is really doing, this is actually, I don't know why I didn't have it here, but these are the worksheet areas where you can actually put historical baseline and projected data as you find them. It's just a place to put it because you're going to want to organize that information so you can eventually add it to an assessment report and maybe slides so you can present this to decision makers and they can determine, they can adopt a vulnerability assessment and really kind of make some choices about what they want to identify as something to address. You can prioritize high, medium, or low risk for all of these things over here, and sort of the same strategy, but you also have a whole list of indicators for impacts and then population sensitivity and adaptive capacity as well. The other thing that this tool does is also try to pair these kinds of exposures, secondary exposures, and impact types to strategy options, so adaptation strategy options. There's about 150 or more in here right now that are sort of for a tribal audience, what kinds of things you could possibly do to address some of these vulnerabilities. And then it gives you a chance to evaluate strategies and do some initial planning on things like time frame, responsible department, resources. And all of this helps you when you go to the process of doing your adaptation plan. And just to mention, we have a whole guidebook on this, on how to access tribal climate and health resilience data. And it walks you through how to use the EASY tool, along with how to, if you, particularly for California tribes, if you are able to work with your tribal epidemiology center, we did a partnership with them to develop a standardized data request tool to ask for particular data sets directly from CTEC, the Tribal Epidemiology Center in California. And so we sort of packaged it in a way that's easy for CTEC to fulfill a data request that was relevant for people doing climate vulnerability assessments. Because epidemiologists have a lot to say if you ask them about the kinds of health impact information that you may benefit from knowing about. I'm just going to kind of skip along and just to sort of note here, we are part of what we're doing is this larger, bigger picture problem solving. So as we dive deeper and deeper into the data that is available, we get becoming very familiar with the data that is not as available as we would like to see it, and continuously refining our list of things that we wish there was better data for, and having those conversations with the state, federal agencies, and other data providers out there to see what kind of solutions we can come up with to make data more accessible. And that's a couple of, the good news is that tribes are adapting already to protect their well-being, and they're doing it in a lot of different ways. We categorize that by looking at things like policy, planning and land use, community engagement, notification, infrastructure improvements, data information and technology, operations and management, cross-agency collaborations. And so that could look like anything from this tribe on the left who developed a microgrid for energy resilience on its fire station to try to lower the risk of power outages to one of its critical emergency facilities. And then down below, I think it's a hoop house for food security. So it could range, the adaptation strategies really range very broadly. And here's just another way to kind of look across all the different kinds of adaptation strategies that tribes are using, have been using around the country to try to protect their community's health. And so you can see the Choctaw Nation has food cooperatives and CSA program, community supported ag program, tribal garden plots. In Kiana, Alaska, they're conducting education to help residents avoid food and water safety risks. And the Blackfeet are increasing water storage capacity naturally by protecting beavers and restoring riparian areas. The Karuk tribe is collaborating with federal agencies on forest management plans, including traditional wildfire techniques. And so there are endless options because unfortunately, when we're talking about health and well-being, we're looking at all the ways that our lives could possibly be affected by climate change. And it's overwhelming. But the good news is, again, if we do these steps, and these are the steps to adaptation planning, so we sort of really are thoughtful about identifying our vulnerabilities and then really constructive about coming up with a potential list of strategies, working collaboratively with our community on evaluating and prioritizing what strategies are really going to be effective, and then putting that into a plan that is actionable. And we've done a lot of the work to really ensure that the investments can go in the best place that they can based on what we know today, which is sadly not everything, but we can know a lot. So with that, my last note here is just to say that there's so much I am seeing from my vantage point, a lot of interest in better supporting tribes in the areas of climate and health adaptation from the White House, from us, because in our National Tribal Resilience Work Group, and even here in California with the California Climate Adaptation Strategy, which is a really nice sentiment. I would say that they're really taking their commitment to working with tribes and learning from tribes as key knowledge holders seriously. And I just leaving it here because I think it's a hopeful note that tribes are in the lead, often in the lead here, have a lot to share, and are very more than capable of being demonstrating resilience and doing even more to protect their communities and saving lives. So thank you so much for having us, and I'll just stop here and say if there's time for questions, I'm happy to take them.
I've been answering a few questions in the chat, and I also want to point out, I asked people to say who they work for and where they are, and we've got a lot of folks working for tribal health clinics and tribal health organizations. So I just want to emphasize, if you haven't done this already, that doing climate adaptation planning is not just for tribes. I think it's a great idea for the health centers to have their own climate adaptation plan. And that's where you can learn about, if you don't know already, about the potential health impacts of climate change, so that you're prepared for this new kind of set of issues that might be coming to your clinics. So I wish we could see like an audience show of hands. I'd be curious to hear if any of the local Indian health boards or clinics have done a climate vulnerability assessment and adaptation plan focused on health. But we've only got 1 minute. So I think that probably we need to pass it back to Maddie and Brett to take us to the next stage.
And maybe I can I just plug this last thing here, which is
Absolutely.
our Tribal Climate and Health Adaptation Summit on July 13th and 14th. We might be already on having a wait list. We're close to being at capacity, but go on our website, and if you want to sign up, please do. And if we can get you in, we will.
Yes, and we also have that event is in our tribal public health broadcast that goes out bi-weekly. So you can also find that information in there. We stuck it in for you guys. Thank you so much, Angie and Shasta. That was so informative and extremely important work that you are doing. And I'm sorry we are so crunched on time, but we would love to have, if you have any questions for Angie and Shasta, please continue to drop them in the chat. You're getting a lot of praise. Everyone's saying thank you. And if also Shasta and Angie, I might ask if you can put your emails in the chat as well. So then people could, if they have questions that come up after the Institute, they can come out, or they can email you.
Yes, but please note that my email address on this slide, it should be paulatribe.com. If you send it to paulatribe.org, I'm not ignoring you. I just didn't get it.
So sorry.
I'll put that in the chat. paulatribe.com. Yes, we'd love to hear from you. And then it looks like Lizzie is asking about
Thanks,
a broadcast that was just mentioned. Not a broadcast, but a summit, an upcoming in-person summit. I don't think we have a broadcast, but just go to our website, the tribalclimatehealth.org, and all of these materials are there. And you can watch our self-paced training videos, and please reach out to us anytime.
Wonderful. Again, thank you so much. Great. Well, we will shift gears now. I believe our three people from the National Tribal Air Association are here to join us. Angie, if you don't mind stopping your share screen, that would be great.
There we go.
Thank you so much. Yeah, and we have invited the National Tribal Air Association here today. Mariah, Janice, and Cindy are here to talk about their work at NTAA and all of the great things they've been up to since we last spoke with them at our last conference.
Good morning, everyone. My name is Cindy Smallwood. I'm the Environmental Director for the Humboldt Indian Village of California. I am also the Region 9 representative for NTAA and the NTAA chair. Janice, do you want to introduce yourself?
Yes, I'm Janice Archuleta, and I work at the Ute Mountain Ute Tribe in Colorado, New Mexico, and Utah. I'm the Region 8 representative on the executive committee for NTAA.
And Mariah?
Hopefully y'all can see me okay. My name is Mariah Ashley. Sheetin Ajane Nishle, Tkanizani Bashichin, Nakai Dashiche Ado Kia Ani Dashanele. I'm currently the NTAA Community Program Coordinator and located in Flagstaff.
This morning, we're going to do a presentation about the National Tribal Air Association to give you a little bit of information on our mission and priorities, but also on the baseline needs assessment, which is a brand new item that was just done this past year. And so it's new and it's new to us. So bear with us on giving you this information, but it's the first of its kind for air in Indian country. So we wanted to bring you this information. So with that, we'll go ahead and get started. Mariah?
Yes. Yes, and welcome to our presentation at this summit. We would just like to start by extending a heartfelt thank you to all of you present at this summit, the NTAA EC, and all the partners who engage with us each day that contribute to the great impact that NTAA has on air quality and supporting tribal air programs. So this year, the National Tribal Air Association is celebrating its 20th year anniversary. The NTAA was founded in 2002 with a grant from the United States Environmental Protection Agency Office of Air and Radiation. Over the years, we've had many EC representatives and partners who have shown dedication to do the work and promote the safety and well-being of our people. The NTAA currently has 155 member tribes. Any federally recognized tribe can apply to be a principal member of the NTAA. You can visit our website for more details. This map just shows where all of the member tribes are located on the map.
Mariah, the slides aren't moving.
Oh, really? I should be on NTAA's mission. Can you see that?
No, we're still on the very first slide.
Oh, no.
Mariah.
There you go.
Oh, okay.
That's showing everything. Let's see.
Okay. Can you see that?
Yes.
We can see it. It's not in presenter mode, but we can still see it. You might have to switch displays on your PowerPoint if you're using two monitors.
Using my laptop. This always happens.
It's all right. We all have tech issues. It's the great beauty of the virtual world. No worries.
I wonder if there's a way to hide presenter. Are you seeing like my notes and everything?
Yeah.
Oh no.
No, we can't see your notes. It's just the regular PowerPoint.
There you go.
Okay,
Yeah.
It's on the third slide now.
That's fine. Okay, I will continue.
All right.
The mission of NCAA is to advance air quality management policies and programs consistent with the needs, interests, and unique legal status of American Indian tribes and Alaska Natives. The NCAA is led by an executive committee pictured here, 2 from each EPA region plus Alaska. EC members are nominated to be seated on the committee. To contact your region's EC member, check out the website for more info and contact information. So that's all of us, the gang. Our goals at the NCAA are to advocate and advance for air policies that fit the environmental, cultural, and economic interest of tribes. And this is all levels of government, tribal, federal, state, and even international. We also promote the development, funding, and capacity building of tribal air management programs. Through our policy resource kits and partnerships, we promote and facilitate upcoming policies from EPA and provide technical information to tribes. Furthermore, we also recognize and stress the importance of tribal sovereignty through effective communication and outreach to state, local, federal, and international agencies, as well as the general public. We encourage and support consultation with tribal governments, supporting tribes in their ability to be aware of, understand, and respond to policy changes that may impact their air programs is one of the important services that NCAA provides. The NCAA accomplishes this through hosting monthly update calls with the EPA that are open to all tribes, publishing a weekly update that includes important policy issues, and creating policy resource kits or PRKs. PRKs typically include a fact sheet to explain the issue at hand, a webinar with presentation, and the opportunity to ask questions. It also includes a template letter that you can use to submit comments and an official comment letter from the NCAA Executive Committee. So these are our goals. And our current priorities at NCAA, which will also be laid out in our annual STAR report, is to provide avenues for proper consultation for EPA leadership and tribal governments. EPA should be conducting consultation with each rule, whether they believe it will affect tribes or not, and should be coordinated early and often. EPA should also take care when conducting outreach to tribal governments on environmental justice issues. EPA should continue to maintain and expand its relationships with tribes without lumping tribes into public community definitions for ease of dealing with these issues. And with climate change, this includes all oil and gas rules, power plant rules. We know that atmospheric warming associated with climate change has the potential to increase ground level ozone in many regions, which may present challenges for compliance with ozone standards in the future. The West and Southwest have seen a decline in unhealthy days over the last 19 years, but a number of cities in these regions are experiencing the highest number of unhealthy ozone days in the country overall. The high ozone levels could result from several interacting factors, including but not limited to higher temperatures, topography, increased emissions of ozone-forming chemicals for more frequent wildfires, high levels of automobile emissions, and an increase in gas and oil extraction operations. Air quality regulations, we are looking forward to PM NAAQS revisions, ensuring EPA rules look at both on-reservation and off-reservation impacts, follow up on the ongoing requests for monthly or quarterly updates on rules coming out so NCAA can plan and prioritize our review activities. And these priorities are also in our website under the latest news, so you can check that out for further reading. To continue with the National Ambient Air Quality Standards implementation, we continue to show support for capacity building for tribes to effectively review state-issued permits. For example, continue to support ITEP training, but continue to provide technical support to tribes in reviewing permits, as well as tribal monitoring, emissions inventory, and data collection and management. Air toxins have been a long issue for many tribes. For example, many tribes participated in the school air toxics programs that continued at the TAM Center after the national program ended. Providing tribes with a better understanding of air toxics, risks, and impacts will better help to determine the potential needs for their communities. Wildfires have been developing across various parts of the world at alarming rates, and this is no different here in Indian country. Drought impacts and climate-based wind events are fueling these massive fires, which do not stop at tribal borders. Wood burning across the Indian country is vast and complex in what fuels are used, how long it's been stored, and covered versus uncovered. The amount of wood fuel it takes to heat tribal homes will also vary on tribal demographics inside the home, proximity to other communities, and economic factors that range from negative finances to uninstalled units that just need installed costs covered only. So right now we're dealing with a few wildfires here in the Southwest already, and these winds are not helping. So having tribes understand the importance of that is super crucial. EPA is now pushing for tribes to go to surge funding. This is state indoor air grants funding. It has also been available for states and tribes. They have been overlooked on this. Currently, there are 10 tribes receiving funding. 50 states get surge funding. Indoor air has always been a hard one because you can't tell people what to do in their own home. For businesses, it's a little different, but still with no policy, just recommendations, it makes it difficult. We also need to change IAQ, indoor air quality, to IEQ, because it's not just the air, but everything that contributes to the quality of life in the home, office, and commercial building. Changing the way people think of indoor air quality might be a better way of dealing with indoor pollutants. As with radon, stating the values as an action limit might get people to look at the IEQ differently. And lastly, the NCAA mobile sources work group has been helpful for tribes to better engage on mobile sources policy issues. So that's a big thanks to Jesse Morose at OTAC for their team and on the work group. With the DERA match requirements, they've been successful in generating much interest spread across the regions. The NCAA seeks to prioritize equitable mobility for tribes and underserved communities by reducing emissions through the electrocution in all power sectors, including heavy and light duty vehicles. The NCAA also has a new Alaska work group, and we are working on finding ways to help Alaskan tribes and Native tribes better engage on recent aircraft rules. So again, this is all on our website. You can take a look at that document that we've shared with EPA leadership and others. So how do you want to stay involved in NTAA? There are several ways. Each Wednesday, we post a weekly update that houses top stories, upcoming calls and events, and funding opportunities. To join the listserv, you can email myself or Andy Bessler. He is our project director. And every Thursday of the last Thursday of the month, we host monthly air policy calls with EPA. We host member tribe feedback calls as well. Virtual and in-person meetings with EPA leadership occur at least 3 times a year, including once during the National Tribal Forum on Air Quality, which was just held last week in Tulsa, Oklahoma. NTAA also has 4 active work groups that are held at varying times in the month. These work groups include the indoor air quality, mobile sources, wood smoke, and the newly formed Alaska Air Quality Work Group. You can join these listservs and you can see when these calls occur, or you can jump on the weekly update, and we also let people know when our calls are coming up. Lastly, ECA members frequently report to the regional RTalks and other spaces such as these summits and forums. Perhaps one of the most important things that NTA does, however, is what we call our policy resource kits. These policy resource kits were crafted to alert NCAA member tribes and other tribal air offices about important proposed rules and provide tools for tribes to use in submitting informed comments on US EPA actions. PRKs include fact sheets, official NCAA comments, a tribal template letter, and other resources for tribes to use in submitting their own comments. Currently, we have 2 PRKs, EPA's proposed federal implementation plan. This action is also known as the transport rule, which helps states fully resolve their Clean Air Act Good Neighbor obligations for the 2015 ozone NAAQS. Secondly, we have the proposed Clean Trucks Plan. This proposal would change the heavy-duty emission control program to further reduce the air quality impacts of heavy-duty engines. A fact sheet for the rule is available to download, as well as tribal template letter and a letter that tribes can use to comment before the deadline. And NTAA's comments letter, these are all available on our website at www.ntaatribalair.org. So check that out. We also have these white papers that our policy advisory committees work on to spread more information. So this is an important one. We call it the PSD. It's how they could better incorporate traditional ecological knowledge and address environmental and air quality permitting decisions. And up next, we will have NTAA Chairwoman Cindy Smallwood, who will speak to our latest work, the Baseline Needs Assessment.
Thank you, Mariah. So for the information, I just wanted to read you this quote that came from the BNA that was 20 seconds left. Oh, okay. The BNA that the Baseline Needs Assessment that was developed during this past year. This quote came from a tribal air program professional. Mankind needs to move away from our learned habits and embrace new methodologies before we destroy our inheritance. In 2022, the National Tribal Air Association celebrated its 20th anniversary, established through tribal leadership and EPA funding. Just 2 years earlier, in 2020, the United States celebrated the 50th anniversary of the Clean Air Act, arguably one of the most successful pieces of public health legislation ever adopted in the United States. These 2 anniversaries mark important air quality milestones in the mission to protect public health, natural, and cultural resources. These anniversaries also provide an opportunity to reflect on tribal air quality achievements to date, along with unmet and emergency air quality issues. The NTAA Executive Committee commissioned this report, a baseline needs assessment, to quantify and characterize these unmet and emergency air quality issues. In the winter of 2021, an electronic survey was distributed nationally to obtain baseline information from among the 574 federally recognized Indian tribes. The 59-question survey collected both quantitative and qualitative data from a total of 169 individual tribal respondents. A total of 129 individual tribes participated, representing 22% of all federally recognized tribes. A little over half of the tribes who completed the survey are current recipients of Clean Air Act Section 103 or Section 105 grants from the US EPA, with the remaining of tribal respondents not receiving any Clean Air Act funding. So what this baseline needs assessment did was it offered an opportunity to do a large scale assessment. It's the first of its kind for air in Indian country. And it offered to show documentation to provide backing to Indian country's repeated statements. And it is an imperfect assessment. For one reason, as I said, it only 129 tribes participated out of 574 tribes in the nation. The key takeaways of the BNA are that EPA's investment in tribal air programs is impactful, yet the majority of tribes report that limited funding has far-reaching impacts. Federal investment in tribal air quality programs is magnitudes of order smaller than the federal investment in tribal natural resources and environmental management. And we already know that that amount of funding is very small. Modest allocation of $12.5 million for tribal air programs places a strain on some tribes via overburdened air quality staff, leaving other tribes without any air quality presence. Tribal air programs need robust and sustained funding so all tribes can decide for themselves how to implement air programs to advance air quality and climate change mitigation. In 2020, NTAA's development, release, and selection of the public RFP, Partnership for Air Matters. Then in 2021, the implemented BNA outreach began. It was done via mail, the NTAA website, email, and other outreach tools. In May 2022, the final report was delivered to the National Tribal Caucus, tribes, and the public. The electronic survey had 59 questions. They were quantitative and qualitative data to better understand tribal air quality programs, financial resources to address air quality, human resources to address our air quality, tribal capacity to address air quality, ambient air quality issues and concerns, indoor air quality issues and concerns, and overall air quality priorities. So this is the design that was used for the baseline needs assessment. The information generated by the survey, the tribal air quality priorities, the characteristics, the financial resources, the human resources, the capacity, and ambient and indoor air quality issues and concerns. This was one of the cards that was mailed out to all 574 tribes. It was also emailed out and posted on the NTAA website. It was also distributed by not only NTAA, but Partnership for Air Matters, tribes, tribal partners, and tribal consortia. As you can see from this map, the survey was, you can see all the tribes that responded. The survey was open for 4 months. There were 339 total responses. However, of those responses, some of them were bots. So we had to validate that the responses were true and that some of the responses were not duplicates or partials. So we had to go through that whole process, and that's how we came up with that 129 were the actual responses. Some tribes had multiple responses for each tribe. So that you can see that on the map. Each region had a response. So all 10 regions responded. And it tells for each region how many tribes responded and how many responses. So after the data cleaning, there was a total of 169 responses. All 10 regions were represented, 129 tribes and 4 organizations responded across 28 states. And now I'm going to turn it over to Janice to go over the findings of the baseline needs assessment.
Yes, so what did we find out? Well, first of all, we had to find out how many tribes did have air quality programs. So out of 169 responses, 53% had air quality programs, but 24% would like to have an air quality program, for an almost 78% total that have or would like to have an air quality program. So EPA funds the Clean Air Act grants to tribes and states. On addressing how programs were funded, we see that 58% had EPA grants, but 41.7% were not covered by EPA funding mechanisms. And in relation to capacity or typical tasks that air programs manage, we address responses to a radon program, and 70% stated that they do not have a program, but would have one if funded. The SIR grant that Mariah had talked about earlier are also offered to tribes. However, only 17% of tribes have surge grants. So what were the ambient air quality issues and concerns for the tribes? 80% had concerns about road dust, and other top issues are wildfire smoke, mobile sources or traffic, and wood burning devices such as stoves. Oops. Oh yeah, that's right. Okay. Go ahead. Another question addressed greenhouse gases in the ambient air and their sources, with tribes responding that transportation and methane producers from agriculture is high concerns. Industry sources, including electric generation plants from fossil fuels, are also important categories of interest. We also discussed indoor air quality issues, and this one covers the concerns at tribal housing. Mold and mildew were high concerns, with allergy and asthma triggers, wood smoke and carbon monoxide being the next most important. And what were the indoor air quality issues for tribal and community buildings? Well, tribes had high concerns about mold and moisture, allergy and asthma triggers as well, radon and carbon monoxide, though toxic materials and asbestos and lead paint were also issues of consideration. So putting this all together, a majority of the tribal responses were in agreement with the statement that insufficient air quality funding impacts the health and wellness of our people. So conclusions were enveloped into funding needs. It would take $22 million to meet the needs of 165 of the tribal respondents for running an adequate program. For tribes these are tribes who already have an air quality program. And it would take $76.6 million for each of the 574 recognized tribes to receive a budget of $133,000. And for the 42% of the respondents who already have funding, the funding does not fully cover their air quality needs. but 76% of the tribes in the nation did not respond at all. So how do we reach those tribes? And the 169 respondents did provide good information. However, we still need to know more about the funding needs from all the tribes in the nation. Okay, now we're going back to Mariah for one more topic.
Thanks, Janice and Cindy. So what are our next steps? It's to publish the upcoming 2022 status of tribal air report. We also call it the STAR, and incorporating the baseline needs assessment findings in the final report. We hope to publish this all in June. This picture here to the left is last year's STAR report. And we usually ask local, whoever hosts the NTFAQ, to provide a nice cover design. So this was designed by Dana Tiger. She's from the Muskogee Nation, and it's entitled Wind. So you can, that report is available online for download. There's also specific sections in there that you can download. But the STAR, it provides a snapshot of the needs, successes, challenges, and priorities of tribal air programs across the nation. And what makes the STAR report great is that we gather stories from tribal air programs, and they speak directly from what their experience is and tell it in a way that comes across to people in EPA leadership and even Congress. So it's a great report. Check that out. We usually also have a presentation to go further in detail about it. And I'll turn it back over to Cindy.
Thank you, Mariah. I wanted to say one other thing before we close out the presentation. The B&A document is over 100 pages long. We only chose to pick out a few items for the presentation that were more health related. So please go to the website. It's listed here on our presentation at the bottom there, so that you can view the document in whole. It will really give you a more full explanation of what the baseline needs assessment information that was gathered. It does give a lot of information on the funding needs in Indian country for air quality and staffing. That was a lot of what the questions were about. So please go there and you can read it more in total. And then also our NTAA website is also listed there. So please go and visit. We have a lot of information, and if you ever have any questions, you're able to ask them there. So I hope this presentation was helpful, and if you have any questions, we're able to ask them at this time or answer them. We can ask them too. And thank you. And I'll turn it back over to Maddie.
Thank you so much, Cindy, Mariah, and Janice. That was incredibly informative and was really motivating to hear about your work this past year. And we will be sure to elevate the STAR report when it comes out and are looking forward to that. So we can take a couple minutes for some question and answers. If you have any questions for use the raise hand feature or drop your question in the chat. Go ahead, Shasta.
Hello, and hello, my friends. Cindy's right down the road from me. I was sort of surprised, but not surprised at the mixed results you got from the survey. Partly I wanted to jump on and say, Paula answered the survey. But for all I know, Daryl, my air quality tech, also answered the survey. He probably did. And I'm wondering if you have any thoughts about how to increase response rates. And I'll just make the observation that even something as simple as a survey where you click a link and spend 10 minutes filling it out, it's still so hard to get responses. So I'd just be curious to hear your thoughts on just that experience.
Well, part of the, last week at the conference, we were asked, is there anything you can do about cutting down the questions? Because there were 59 questions asked. And you ask the questions so that you can get to that one answer that you're looking for. I mean, part of the problem is the questions. Part of the problem is people answer multiple times because they can't remember if they answered the question or answered the survey to begin with, because it's open for 4 months trying to get answers. Shasta, I don't know. It's just hard to say. The outreach was there, but maybe I don't know, maybe we need to cut it off sooner. It was maybe open too long. Who knew that we were going to have so many bots answer the survey? I mean, 339, and in reality, it was only 169. So I don't know. First time trying. Was a good try, but
Cindy, I have a little
go ahead, Janice.
what happens with our tribe,
Mhm.
a lot of things go to the chairman, and so I think because we knew about a lot of tribes that had air quality programs, you knew those contacts. But for other tribes who maybe the air department is, in the environment department, if they have one, or where is it, so that you just send it to the main tribal contact, which, usually is the chairman's office. And then half the time, does it trickle down to the right department? So I think that's an issue with the tribes that may not have an air quality department or air quality program.
Could be.
I wonder if we should have, I mean, this is kind of tongue in cheek, a survey about how to do surveys.
Right.
but like maybe at the next Tribal Air Conference or at our regional conferences, I wonder if we could find some experts on data collection that could help us all with, because I do surveys all the time and don't get great responses, and on some best practices, because these things are so incredibly important. But if we can't get the answers we need from the tribal communities we work with, we can't develop the tools that we need to help everybody. And we know that capacity is such an issue, a tremendous issue, so many things to consider. So I'll throw it out even to the audience that's here, that if anybody knows of or is a qualitative data specialist, help us, please.
Yeah, definitely. Yeah, thanks, Shasta. Appreciate that.
In the chat, it was just saying that somebody, Rachel said bots have become a huge issue with electronic surveys. And I think even we partnered with Partnership for Air Matters, and they were talking about potentially if there was a next time to do this, that they'd have to put some sort of like software there to like some sort of firewall. I'm not really tech savvy, but something of the sorts to kind of do that, because we got a response from New York City where they said that was where the Navajo Nation was located, and we're like, no, that's not accurate. But Lizzie, go for it.
Well, I just have a thought. So I feel a little I'm definitely like ignorant. I am a grad school student. I'm mid-career, but I've only been working with tribes for about 6 months, and I'm just loving the work. But I noticed this also from work outside of tribes too. And I think the question is, okay, so if you wanted to reach every tribe, would it be worth like using an intern or something to actually try, like literally trying to do outreach to all 500 tribes to say like, hey, we're trying to get the answer to this because it's important. And I know like the thought of spending the time individually reaching out to everyone is crazy, but there is like free labor. And I'm just wondering, because I know that I'm interning for the Yurok tribe and we're doing a community needs assessment and we're calling a lot of people and everything, but I'm wondering if the pain of individual outreach to get such important information might be worth getting the data that you need. So it's just a question I wanted to throw out there.
Yeah, it's an idea. It's another way to do it. If we had lots of people, lots of staff.
You know, just because I have nothing better to do since I'm bored at home right now while I recover.
We're glad you're recovering, Shasta. We're very glad.
Thank you. Yeah, I'm just dying I'm going stir crazy. I was a consultant on a California outreach called the California Tribal Gaps Analysis, where we were intended to talk to as many California tribes as we could about their needs for climate change and sustainable energy. And it was funded by the state of California, but we did actual on the phone or over Zoom, or even if, you know, we couldn't do in person, but we would have tried that if we could. And that was really the only way we could get the detailed information that we needed for what was actually, Cindy, I think you took the survey, an incredibly complex survey that nobody would have taken on their own, I think. But I think that's a good thought, that we need to do some of this stuff with more targeted, picking up the phone kind of outreach. But then I'll also say, if you're me and you see a phone number that you don't recognize or something, I'm like, I'm not answering that.
Yeah, you don't.
If I get a voicemail that says, well, call us so we can give you a survey, I'm like, but I got better things to do, you know, take a hike. So
Right.
there's always, but I think that was Lizzie who made that suggestion. You're absolutely right, especially in tribal communities. Sometimes, you know, face to face, or at least phone to phone, is the way to go.
Right. And Bertie says the same thing. West Portland area Indian Health Board, they hire interns to do that. So they do it over the phone and in person to eliminate the bots. And Mariah, thank you. Mariah has put the B&A key findings to the B&A in the chat. Thank you.
Yeah, I just wanted to say too, if we had more time, because I honestly think that like 4 months for a survey is probably not enough time. Maybe even 6 months would have been better. But we did have an intern, I get Cindy and Sydney mixed up, but her name is Sydney, and she worked with Gillian Middlestead to put this report together, and she had to do a lot of verifying. So she called a lot of everybody in the data sheet to verify that their submission was accurate. But if we had more people, more funding, which is always the issue, because I don't think we should not pay anybody to do work.
Right.
It's very time consuming, and but there's always that issue of funding. So yeah, but maybe if we extend it, Cindy. Are there any other questions? Comments?
Good discussion.
It was great discussion. I will agree that time and funding are always the competitive aspect of public health work in Indian country. If anyone else has any questions, please feel free to go ahead and raise your hand. We have time for one or two more, but if not, you can go ahead and also ask your questions in the chat. Mariah, Cindy, and Janice, if you feel comfortable, leaving your emails in the chat as well, so people could potentially reach out one-on-one if they have any more direct questions. That would be lovely.
Will do.
Thank you. And if nobody has any other questions, we are going to turn it over to our friend Craig, who is on the executive committee of the National Tribal Air Association. And Craig, just give me 1 second while I go ahead and get my screen shared, and then we'll let you take it away.
Sure.
Good luck, Craig. Good to
Hey.
see you.
Hey,
Good to see you.
I get to,
Good
yeah,
luck,
good to
Craig.
see you. I saw you quickly last week, but man, I've had a lot of different changes in life with twin boys and yeah.
Craig
position
is a
changes.
new dad.
New dad, yeah.
Congratulations.
Oh, wow. Congratulations. All right, Craig, you are ready to go whenever you are ready to go.
Thank you. And you'll be advancing slides for me, Maddie?
I will, yeah, just give me the go ahead.
All right. Well, good afternoon and good morning still to some. I'm very honored to present with you all today. Listen to Shasta and I, and she still serves on the Tribal Science Council. I was on it for a few years. Stepped down, and I'm still the EPA Region 6 representative to the National Tribal Air Association. I lead the mobile sources work group within the NTA, and to some of the baseline needs assessment. You know, as you guys saw, mobile sources are still, you know, of a large concern to tribes all over the country. You know, road dust, you know, tribes in Alaska, those experiences they have with road dust, mobile sources, you know, lead in their fuels still. But, you know, it's an honor to be a part of that group, you know, and helping tribes, you know, kind of understand those impacts they have on their land. You know, I guess I kind of, again, it's kind of my honor to do that and be a part of those groups. But I'm actually going to go hone in on, you know, our specific issues and concerns, you know, public health concerns from legacy mining, lead and zinc mining here within Northeast Oklahoma, within the Quapaw Nation's reservation and the Tar Creek Superfund site. I'm going to kind of point out some of the issues over the years and kind of what's been done and what's going to be, you know, hopefully done here, you know, as we progress in our cleanup activities throughout the site, as well as within the county. Tar Creek's, while it's 40 square miles, you know, drawing arbitrary boundaries, you know, it really makes up much larger of an area than just that. So next slide. So just the history quick of the Quapaw Nation, and sorry, there's hardly any words to some of these slides, but I'd rather just talk to you all, you know, and narrate it. You know, the Quapaws, or the downstream people, you know, originally came from the Dahegan Sioux sort of group, the Osage, the Kansan tribe, you know, various other Dahegan Sioux that, you know, were of the Ohio River Valley, you know, century ago, and started migrating and moving. And the Quapaws, as they're called, the downstream people, migrated downstream down to the Mississippi River to where the Arkansas conflues. They're today present day Arkansas, and actually the Quapaw name Arkansas came from another tribe, the Illinois tribe, and gave them the name Arkansas. And you know, as we can kind of loosely word that, the statehood, you know, the state name of Arkansas comes from the Quapaw people, the downstream people, Quapaw Ogahpa, as they're called in their language. And you know, they, you know, territorially had, you know, roughly 30 million acres of land through present day Arkansas, Louisiana, Texas, Oklahoma. You know, a lot of land that, you know, until about the early 1800s, they called their home. You know, hunting, fishing, you know, they were farmers. You know, they owned that land and called it their home. And until about 1818, where there was a treaty that ceded quite a bit of their land, and then another treaty, several treaties up till about 1833, you know, ceded all of that land and were relocated to present day Oklahoma, which at that time was Indian territory, which Northeast Oklahoma, their land, which now is about 60,000 acres in size, roughly, borders both Kansas and Missouri. You know, so that was in the 1800s. They did self a lot back in the late 1890s, and then you know, have called Northeast Oklahoma their home since that time. You know, mining came in right around that time as well, the early 1900s. The next slide, please. Mining came in right around that same time, the early 1900s, and this is a picture circa about 1918, I think, of Pitcher, Oklahoma. But the tri-state mining districts, so Kansas, Missouri, and Oklahoma, you know, there was the lands in those areas were mined heavily for lead and zinc. So a lot of lead and a lot of zinc early on, you know, and as you worked into the two world wars, a lot of the lead and a lot of zinc were used for the war effort. And so Pitcher, Oklahoma, being right in the heart of Quapaw land, you know, there was a lot of mining leases that were had on tribal land and non-tribal land, but you know, primarily on tribal land. And so as these mining companies came in and leased the land, they went to the Bureau of Indian Affairs, you know, to help manage that lease. And there were at times leases that were executed not on behalf of the tribal member, but for the benefit of, say, the Bureau of Indian Affairs manager, the one that managed those leases and those lands. Because they deemed these tribal members incompetent of managing their land. So those executed leases were had basically between the mining companies and the managers of these leases, and not the tribal members. And there was just, you know, we can talk about environmental justice really as far back as, you know, as the land being ceded from the tribes and all the tribes, you know, as we you know, look at the history of a lot of these tribes being relocated through the years. But the impacts from the mining, and then we'll get to the environmental impacts here soon, here within Quapaw land, and then also the effect of the downstream communities and several tribes in the area that have been impacted by the mining. So they mined roughly till about 1969, 1970 was kind of where the mining petered out. So you see all these big chat piles in the back of this picture. You know, all of that material came from below the surface. So there's all these room and pillar sort of formations. They could be in, you know, stacks, room below room to about 400 feet below the surface, bringing up the ore and rock. So the rock was crushed because a lot of that ore body was in the rock, so it had to be crushed down to a very small fraction, and that's what made up these piles, and it was locally called chat. You know, across what we still kind of draw out about a 40 square mile boundary is where they did a lot of the mining within Pitcher. And they discovered that Pitcher minefield, you know, later on in the mining of the tri-state mining district, but it was just so, you know, the ore, you know, the content and the grade of it was so significant that they really just started heavily mining, and a lot of the other mining in the area petered out, and they focused here in the Pitcher area, again within the Quapaw Nation. Next slide. And here's just an aerial, kind of to give you a picture of the 40 square miles that we're really going to talk to, and some of the impacts and the lead impacts, the health impacts of it. So 40 square miles, you know, hundreds of leases, mining leases were had in and around Pitcher, Cardin, just really where, a lot of that good ore was, that lead and zinc, and pulling it up, and, getting it off to a smelter was, what was had. They did a few different types of mining. Like I said, they crushed it and sieved it, and got all the good ore out. But later on in mining, as they were really wanting to, and technology came about, they could further extract and recover more of the fines and more of the very fine pieces of the ore and the lead and zinc, and they floated it. So they floated it and mixed some chemicals, and were able to basically skim off, just even more of the metals, and to further process it. But then, so you've got these chat piles all in and around Pitcher Carden, and then you have these fine tailings facilities that are scattered as well. And what happens when the further you process and the further you break down this rock, the more surface area you create within that rock. And, as the testing was had, you actually are concentrating the waste, essentially, the further you break down this rock. So when we go to these fine tailings facilities and look at either remediating them or capping them, they are the most concentrated, they're the most impacted lands around here. And there's quite a few of these tailings facilities that we also have to address. But what's going on in this area? So you've got chat piles, you've got watersheds, you've got it's Oklahoma. It's always, the wind's always blowing. So we've got impacts in the air, in the ground, in the water, and this was a very thriving mining community for several decades. So what happened? Okay, well, we've got a lot of product that is not really of any use. Well, it's great. It makes a great road base. So what did these communities do? Well, they called the chat and laid their driveways with this stuff. Oh, the super fine fines, the tailings. Oh, what does it look like? It looks like sand. Well, why don't we take that material and put it in our kids' sandboxes and let them play with it? Well, later on in the discovery of the impacts, and prior to this site being listed on the National Priorities List for EPA, they started uncovering the impacts to kids in the blood lead level, in that realm. The impacts, the neurological impacts, as lead's a neurotoxin. They were seeing sort of in the school environment, how say delayed or just behind they were in their development under the age of 6. And they started noticing that they once the mining ceased. So as I discussed, they brought all this material up from below the surface. When they shut the mine operations down, they also shut the pumps that were drawing the water table down, because they were mining in an aquifer. And so when they shut the pumps off, it took about 10 years for all those voids to fill up. But once they filled up under artesian flows, this acid mine water started to flow out to the environment, impacted, rust colored, the minerals that are there with the chemistry that also was in the mine pool would come up and oxidize and, basically come out, rust colored, lower pHs, just really nothing that, allows a thriving stream to prosper. It was just all impacted, no species of fish, bugs could tolerate that water chemistry. And so, tribal members, community members, a lot of people love to fish around here. They just couldn't, if they did, they potentially could face impacts to that. When the chat then later on began to be processed, it's, again, like I said, it makes a great road base. They've proved its use in asphalt, because asphalt shows the oils in asphalt will actually bind up and not allow this chat, to leach out into the environment. But as the processing was happening, you're exposing these chat piles that for years weren't touched. And if it's windy, you're sort of redispersing that sort of grain, or that grain size, that fraction of that chat into the air and dispersing it. So there's just, as you guys can kind of picture now, a lot of different impacts coming to this area prior to EPA coming. So next slide. I think it's a brief, yeah, and just a quick brief history of it. They began in the late 1800s and went through about the 70s. Again, they had a few different ways of processing it, and they produced more than 500 million tons of waste in the area. A statistic I know off the top of my head, so for every ton of ore that they took off the site to process to take to a smelter, 16 tons in the form of those chat piles you see in that picture were left behind. So that's where your 500 million tons of waste in the area were produced. And, over the years, materials been processed, been used in asphalt. But again, like I said, they were used in driveways and other sort of, chat or concrete products. We call it chatcrete. They were used in, kids' sandboxes. So over the years, the 40 square mile footprint we kind of have been talking about has reduced itself to less than 50 million tons. So there's still a lot of waste to address, and that's what we're addressing now. But there's also material, if it's not been put into asphalt, there's material out there in driveways that are still need to be addressed. There's a lot of public awareness that's still going on, and I'm going to get to some of the other ways we're still doing testing and making the public aware of the issues still at hand at Tar Creek. So this kind of gives you a profile of these chat piles. That's a pretty large pile, but there's some that were as tall as about 1,000 feet tall. Later on in mining, they started consolidating the chat processing and started taking a lot of the material to one site, let's say, and processing it. So these piles just got massive, to where one of the piles had a light tower on it because there's a local airport that needed to know that pile was there. So the Federal Aviation put a light tower on it to mark it. So next slide. So EPA comes in, this is about 1980, and all these sort of environmental sort of issues have come up, the blood lead they've discovered, the impacts to the groundwater, the impacts to the air, all kind of culminated into, EPA has to come out and do an assessment. And as some of us know, EPA newly formed CERCLA, and the Superfund process was in the 80s as well, the early 80s. And Tar Creek, one of those first sites that was listed on the national priorities list based off, a hazard ranking score, its magnitude and extent. Like I've talked, 40 square miles is a very large site. And what we're still doing today, brings about the nature and extent of that contamination still present. And being as big as it is, EPA had to break up and still breaks up these sort of manageable units in chunks into what we call operable units. So right away, they first wanted to look at surface water and groundwater impacts. Like I said, the groundwater is bubbling up and impacting surface water. So they were trying to address some of that. It was a failed remedy. I think EPA wants to, hopefully go back and explore some ways of treating the groundwater or treating that surface water. But I'll get to it in the Operable Unit 5 and the sediment, what they can do. Operable Unit 2 in the 90s, they said, well, okay, yeah, all this chat's kind of went all over the county. Chat and its marketability, like I said, it's used in asphalt. It's got about a 200-mile radius of the area. So there's say chat buyers, there's chat processors, there's people that are batching the chat on site and putting it into asphalt and putting it right into the roads in the area. But a lot of this material is still out in yards today. As people took the material, put it in their driveways, there's alleyways, there's high access areas, as we call it. There were parks and different areas that the chat was used, as a road base, as a parking lot. So EPA, the state of Oklahoma and their Environmental Quality Division, as well as the Quapaw Nation are looking to address still the residential yards of the communities in the area. Operable Unit 3 was a office complex with some chemicals and some drums. That was a quick operable unit and a closure. Operable Unit 4 is where we're at today, and that's looking to address all of this chat. And you can see in the background another picture of a pile that we're either marketing its use or we're hauling it to a central location. We call it the repository. You want to think of it as a landfill. We're hauling a waste to a landfill, but it's consolidated all in one large landfill that we can operate and maintain for its life for forever, instead of having all these piles everywhere and trying to manage it as it is now. We'll have a big cover on it with soil and grass, and it'll just have to be maintained for forever. But that's what OU4 addresses. And also with OU4, and I'll get to it, it was a voluntary buyout of the pitcher community. And then lastly, Operable Unit 5 is looking at the sediment in the surface water, because all these chat piles, are in and amongst watersheds, and as it rains and floods and redistributes the sediment or the chat and the fines and all that material into the watersheds, now the sediment in these streams are impacted. So EPA is now working through the early stages of the remediation process to get Operable Unit 5 to a record of decision, and then implementation of the record of decision in those remedial goals. So next slide. So with OU2, the residential yards, EPA also is kind of tasked now, the Oklahoma State Department of Health, to continue monitoring, as well as if you're wanting, say, your child to be a part of the program, to sign up for the blood lead level and testing program within the county of Ottawa County. You can go to the link there at oklahoma.gov health, the lead poisoning prevention program, but they're really targeting this area because of its lead impacts from mining. And we still today see, families, not to say aware of the issues at hand from the mining, but there's also still, people that are not of, sort of the awareness, that there's lead in homes still. And that EPA can't really, from the Superfund perspective, can't really control that. Lead in homes, lead pipes, lead paint, you name it. But Ottawa County and the state Department of Health can do some sort of prevention, measures. But they started within this program, the free lead testing for children 6 months through 6 years of age in this area, and it's still going on today. There's, I can't remember the percentage. I should have found that percentage, but there was still, roughly 5%, I think, of that age group. 5% were still exceeding the blood lead. I think it's 5 deciliters per microgram or something. I'm terrible with the units right now, but 5% of those children in the Ottawa County program are still exceeding that threshold. And as some of us are aware here, CDC's dropped their standard, and I think EPA is considering dropping the standard that we then kind of set our cleanup goals to for blood lead. And we do a different model for blood lead as compared to zinc and cadmium that are other measurable remedial goals that we strive to do, but those are more ecological concerns and risk factors, where lead is a human health risk factor. And we continue to promote the program. The pitcher area, I'll get to, there's just very few people residing in the area anymore, as there was a buyout, and I'll get to it. I think next slide. Yeah, well, I'll do the HIAC. access areas quick. So the residential yards, so we're moving, let's say, I'm trying to think how we do about an acre's worth of someone's yard. We assess it, we sample it down to 18 inches. Is it impacted by lead? If it's above 500 parts per million lead, there's measures that are taken to excavate that soil, bring back clean soil, and then revegetate. But that's the residential yard process, and high access areas, parks, alleyways, different things that the EPA and then the state of Oklahoma's Department of Environmental Quality kind of takes the lead on those ongoing efforts. But as I said, an OU2 has been going on since 1997. There's still, people are signing up for the blood lead testing. They're as well signing up for the residential yard testing because they still feel there's impacts to their homes that hadn't been addressed in the past. At some point in the future, we'd like to think we've got every single home that brought chat to and put in their homes or put in their yards and driveways and stuff. But there's just no telling. There's just so many communities in the area that utilize this material for so long. And like I said, this last bullet point does not include in-home testing. So, EPA is not going into the homes. The state of Oklahoma and Department of Environmental Quality and the Ottawa County Public Health is not going into homes and doing the testing. Now, there are other measures that are going on. So Indian Health Services can do some of this. There's some tribal housing departments that will do in-home testing. They'll take their XRF, their X-ray fluorescence, portable, guns and do some assessments for tribal homes, but not on the EPA Superfund side. So we're kind of limited there. But if we do have someone call asking about in-home testing, we usually refer them to the tribal housing departments or Indian Health Services. So next slide. Yeah, so OU4, the mine waste and the voluntary buyout. The big focus as we're doing it today is now removing the chat, but the big focus when this OU4 was sort of enacted or come to decide on the record decision was the voluntary buyout. Okay, mining was had. There's a lot of undermined areas. The potential to collapse is there. The impacts to these homes with these kids is there. The risk, the blood lead. A lot of things culminated in EPA saying, "Hey, we've got to get these people out of here." So they did. They spent a few $100 million, assessing homes. Kind of giving them a fair market value to the homes and doing sort of comparatives of the area, not considering the impacts from mining, but then they were essentially bought out. EPA came with the state, wrote a check to these families for their home and their land, and they removed themselves from that location. Some of them took their homes with them, some of them left them. Those were then demoed and buried under a underoperable unit 2, actually, because it's a residence. But yeah, there was a large buyout of the Pitcher Cardin area, and I want to say there were more than 1,200 homes that were bought out and people relocated. And what's kind of ironic and sort of you just kind of ask yourself why it was done, but again, like I said, OU2 came before OU4, and so in the Pitcher Cardin area, EPA came in with a lot of money and started remediating all these yards before the buyout. And so the Pitcher area today has hundreds upon hundreds of lots that were remediated. So there's clean soil out there, but then let's say they spent $120 million doing that. They then then came and bought everyone out for another $100-some million. So, EPA's spent a hefty amount of money through this process, but the voluntary buyout came because of the immediate, and the warning, I guess, that came from the Army Corps of Engineers subsidence evaluation of Tar Creek, that the potential to collapse is highly likely in a lot of these residential areas of Pitcher and Cardin. So that was a warning shot, as well as the blood lead impacts to the families of young children. And that was had in the 2006, 2007, 2008 time. And then since then, under OU4, we have just been addressing the mine, the chat features, the upland chat, and getting those out of the watersheds, getting them consolidated in our repository, and trying to reestablish some of this land and putting it back into some beneficial use for a tribal member, a tribal family, the tribe, a community member, a landowner, a private landowner. We're looking here to address that. And the tribe itself is doing active remediation, which is very unique. The Quapaw Nation at this time is the only tribe taking active remedial work under Superfund. So we take a work plan and budget to EPA and basically proposing how we'll do this work, our equipment, our time, our efforts to go to a site with 500,000 tons of material and remediate it. That's on us. That's on our office. That's on our construction department. And EPA's kind of turned the reins over to the Quapaw Nation, cooperatively through cooperative agreements with the state and with EPA to address both tribal land and non-tribal land within the Tar Creek Superfund site. And that's OU4's mine waste sort of remediation efforts. Next slide. In our outreach efforts, we can't, talk enough about it. We have to continue making the community aware of it. There's, constant issues and from the public perception in their eyes, Tar Creek's still got a long ways to go. There's a spot at Tar Creek called Douthat Bridge. If you go there, you can see all this mine water discharging and all of it impacted. It's rust colors. It's low pH. It's there's just no species really tolerant and thriving in this area. And they go there, so we have to educate them. Hey, while you see this going on or not going on, we still have a lot we've been doing and tackling and addressing over the years, sort of on the fringes, right? These people go and they go to one spot and say it's not done, but we utilize local environmental action demanded lead agency here in the area. They are sort of our environmental guru and getting the community involved and made aware of our issues, the tasks at hand. They've helped get Tar Creek on the map. It's now, I think, the 2022 and most endangered rivers of the US includes Tar Creek on it as number 10 this year. I think it was number 6 last year. So lead agency is very much a key piece to making the nation aware of the issues at hand at Tar Creek. We have EPA makes us generate community involvement plans, and then speaking with tribal leadership, speaking with the tribal members, speaking with the community members, the leaders. We have a lot of outreach efforts. We have a lot of different community health fairs with brochures, or just people can come and talk to us about our ongoing efforts. And it's just so important. We'll team up with the Ottawa County Health Department, and they'll do free blood lead testing. If you're interested, or you just don't know, you come and get tested. And then if you need to address those concerns, we can help meet the right people, help you meet the right people. And that's Tar Creek. There's just ongoing issues. There's always that thing, that the feeling over you that if you're walking out there in Pitcher and doing some work, there's areas that are collapsing and are reopening every day. as I said, it's heavily undermined throughout the 40 square miles. So there's just the potential to collapse always there. And the rain we've received. So we were at the National Tribal Forum on air quality last week and received a bunch of rain. And I'm sure there's been some collapses, mine shafts opening up, or just subsidences, large subsidences due to all that rain, all that pressure, just caving in. There's so many voids still in the area that we haven't addressed, haven't looked to address, but we will. Time is money, right? And we need a lot of money to get this work done. We're spending $20 million a year at the rate we get it, from Congress through EPA, through Superfund, to address the cleanup. We're addressing, air quality impacts, water quality impacts, the soil. As we remove the chat from these surfaces, the soil below it hasn't had any sort of nutrients, or been deprived of everything for decades. So now we've got to look at amending the soils, trying to rehabilitate the soils to generate vegetation and prosper. So, and that takes time. It will take time, and we have to look at this from the mindset of how this will look 7 generations from now for those tribal members that are going to go down to these creeks and collect, hopefully, subsistence cultural practices that they kind of always envisioned and wanted and hope to have. But it just takes time, because we started from very little, after the mining. Water quality is deprived, the air quality is impacted, the soil, we just can't grow crops on it. We can't grow vegetation for the cattle to graze on until we give it some time, give it the right nutrients, give it the right fix that's going to allow it to thrive. And we have ongoing restoration efforts, and we have the community involved in those. And it's one of patience. You definitely have to have patience in this field, in this area, because it takes time. It took time to do all the mining that was had, so it's going to take that much time or more to restore it. And it might not be what it looked like prior to mining, but our restoration efforts are going to do, I think, a bang up job on getting them back to some level that the tribe can utilize it to their advantage, to their specific uses. Next slide. I don't know if I have much left. Thank you. So yeah, I mean, and then in closing, again, it was very nice to speak to you all today. I do like this virtual setting. Being a new dad, it's just hard to pull away. I was at the forum last week with Sydney, with Mariah, with all my other executive committee counterparts, but for about 4 hours, and then I got pulled back this way and got busy with family stuff as well. But these virtual settings are nice, but I do hope to meet many of you in the future. So with that, thank you. And we've got some time, right, for some questions. Am I the last one? Am I? Almost look like we're frozen, Maddie, or you are. Sydney, do you hear?
Yes, we absolutely do have time for questions. Thank you so much, Craig. That was extremely formative and motivating. Oh, can you hear me? Hello?
Yeah, I can hear you.
Am I lagging? Technical issues. Oh, you can hear me now?
Yep.
Okay. I was just running through the same. Thank you, Craig. That was really informative and motivating, I'm sure, for other tribes who are, looking to get involved in restoration and reclamation work. Thank you for that. And if you, same thing, we're going to open it up for questions for Craig. Please use the raise hand feature or pop your question in the chat.
Shasta, I know you have a question.
People are shy.
Well, and if there's not, my email's there. Please feel free to reach out. We stay busy, but we're
Thank
always
you.
here to help. So.
Absolutely. Thank you so much, Craig. And thank you to the National Tribal Air Association, the Palo Band of Mission Indians, the Quapaw Nation for your participation today. We really appreciate your time, and thank you all for joining us.